The top candidates for PRP joint injections are going to be people that are suffering from chronic injuries. So let's just say you have a torn meniscus or an ACL, MCL, that chronic, usually dull, achy pains, climbing up the stairs, if it's achy in the morning, if cold weather makes your joints hurt, those are probably the best candidates for treatment. That type of pain is usually caused by osteoarthritis. Osteoarthritis is joint and bone inflammation. So I usually explain it like a cut. If you have a cut on your arm, it usually scabs up and it heals and it will assimilate and close. But on the inside of a joint, it happens the same way. So inflammation comes, catabolic proteins will start degrading the joint and start rebuilding tissue or connective tissue. When the joint is damaged, it secretes calcium and then the body absorbs it all and brings it back. But residually what is left into the joint is going to be calcium deposits or bone spurs and low-grade inflammations, which is the catabolic proteins. So over not just weeks and months, over years and decades, it can cause dull, achy pain that gets worse and worse over time. So those are the best candidates for treatment. Acute injuries, it's not the best on acutely. Your anti-inflammatories and just your RICE, your rest, elevation, compression, and elevation is gonna be the best. But if you have ligament tears, labrum tears, let's just say herniated disc in the low back, and let's just say you have hip impingement, you have talocrural impingement of the ankles itself, if you roll your ankles a lot, those are the best candidates for treatment of inflammation in a joint or ligament and connective tissue damage. And check out the next video for more information around cortisone and PRP.